And we have finally reached section 7.8 on bone fracture and repair. So here's your one learning objective. And what is a fracture? It is going to be a break in bone. And I made this section a little bit more detailed because I wanted you to be able to identify these fractures for your lab. So our types of fractures could be a stress fracture in which we have a thin break caused by an increase in physical activity. So let's say somebody was a runner and not well conditioned, they might have these stress fractures if they overdo it. Or we could have a pathologic fracture in which the bone will be weakened due to a disease. And so here we're going to talk about a couple ways in which we can classify fractures. We can classify them whether there's a penetration of the skin. So if we have a simple or closed fracture, that means we have a clean break and it's not penetrating the skin. Whereas if a fracture is open or compound, that means the broken ends of the bone are going to protrude out of the tissue and skin. So I wanted to give some x-ray examples of this. Here's our open or compound fracture. Here you could see that the ulna has moved out of the skin. And then in this view, or this example, we could see that the radius is moving out. And then here's a closed or simple fracture in which the tibia has been fractured, and you can see it is contained here in the calf. And then if we have an orientation, or we're describing the orientation of a break, we can describe it as being transverse, meaning it's perpendicular to the long axis of a bone. It could be linear if it is parallel to the long axis of the bone, or it could be described as oblique, meaning it's diagonal to the axis of the bone. And here are some x-ray examples. Here is a linear fracture. It's a little bit difficult to see in here, but you can see that there has been damage over there. And then transverse fracture, again, you might have to adjust the lighting on your screen, but it's this little gray line in here. And then this is much easier to see, this oblique fracture that is in a diagonal. Now we can also describe a fracture based on the position of the bone ends after the fracture. So if it is non-displaced, then the bone ends retain their position. But if it is displaced, that means the bone end is out of normal alignment. So here is a displaced fracture. You could see that on the tibial shaft, it has been shifted over. And then here is a non-displaced fracture of the fibula, where the bone is still in alignment, but of course we have a break within the bone. And here are some other types of fractures. We have a comminuted fracture where the bone fragments are broken into many pieces. So you're typically going to have about 3 pieces or more. We have a compression fracture, which is when a bone is crushed from upward or downward forces. This is typically going to take place in a vertebrae. We have depressed fractures, that is broken bone that's pressed inward on the skull. So sadly, this takes place in a lot of abusive cases where a blunt object has been thrown to the head. And then we have spiral fractures. Here we'll see that we'll have a jagged break as a result of excessive twisting of a bone. And we see this in a lot of child abuse cases where an adult will take a child's arm and twist it, or it could be their leg, of course. And here are some examples of x-rays of these fractures. So here we see a comminuted fracture. You can see many bone fragments here. Our compression fracture, you could see that this vertebral body is much thinner than compared to the other vertebral bodies. Here is a depressed fracture in which we see just a inward pressed area here in the skull. And then our spiral fracture is of the humerus here, where you see a little bit of a jaggedness to the break. And this is the last slide on the types of fractures. We can have an epiphyseal break in which we are going to have that break occur along the epiphyseal plate. There are different types. You don't have to know the different types, but I wanted you to be aware of that. Sadly, my own dog has suffered from this in his forearm. One of his bones, when he was a puppy, I don't even know when, probably before we even got him, but he had some type of trauma to his epiphyseal plate, and so that caused one bone to stop growing in his forearm and the other to continue. So his paws twisted out a little bit because of that. And then green stick fracture is when we have a break, but it is incomplete. It doesn't go all the way through. And then these are just some other common fractures like Colles fracture, in which we see that the distal part of the radius breaks. This typically happens when an elderly person falls on an outstretched hand. And then we have Pott's fracture here, where we have a break in the malleolus of the tibia and the fibula. So this one is of the fibula. Tibia is not pictured. So let's take a look at these x-rays of these fractures. We have our epiphyseal fracture, where we see damage to the epiphyseal plate, and then a green stick fracture here, where the fracture is incomplete. It doesn't go out to the other side. Here is Colles fracture. It's a slight gray line that's going across over here. And I feel like this picture is too small for you to see this, but there is another one over here. We have Pott's fracture, where we have a break within the fibula and within the tibia. And this is just another view. And here is the table that is in your book. We covered most of these except for a hairline fracture. That's just going to be a fine crack in which the sections of the bone remain aligned, and it's common within the skull. And I think that's the only one that we did not cover. Yeah. So how do we heal a fracture? A simple fracture can take 2 to 3 months to heal, but a compound one will take longer. And we also have to be careful that infection does not take place in that situation because there is a break of the skin. Now, there are 4 steps to fracture repair. The first step is for hematoma to form and create clotted blood here. So our blood vessels where this fracture took place is going to be torn within the periosteum. So of course we're going to have this blood kind of pool up and then it'll clot. Our second step is for this fibrocartilaginous soft callus to form. Our fractured hematoma will reorganize into connective tissue, and that's called a procallus. And the fibroblasts within that connective tissue will start to secrete collagen fibers. Our chondroblasts then are going to form dense, regular connective tissue, and the procallus becomes a fibrocartilaginous callus. Our third step is to form a hard or bony callus. So our osteoblasts are going to move into this area adjacent to that fibrocartilaginous callus that was produced, and the osteoblasts will produce trabeculae. This will replace that callus and form a hard bony callus, and then it'll continue to grow and thicken. So we can see that we've got this thickened area in here. And then the fourth step is for this bone to be remodeled. So we are going to have the osteoclast start removing the excess bony material here in the medullary cavity, and compact bone will replace that primary bone that was built along the sides here, and will usually leave a slight thickening of the bone in that area. And that is it for Chapter 7. If you have any questions, please contact me.